I ask for unanimous consent for Ms. Stefanik, Mr. Jordan, Mr. Langworthy, and Mr. Moskowitz to participate in this hearing for the purposes of questions. I now recognize myself for the purpose of making an opening statement. Mr. Cuomo, welcome. I want to thank you for your willingness to participate in today's hearing and for testifying in front of the Select Subcommittee more than 2 months ago. It took issuing a subpoena to get you to then agree to testify previously, so I appreciate you coming in voluntarily today. Before we get into the substance we are here to examine, I want to tell you that this subcommittee has been threatened twice this Congress. Once by the Chinese Communist Party through its embassy for examining the origins of COVID-19, and a second time by you through your counsel for examining the handling of COVID-19 in nursing homes. I can tell you, we have not and we will not bow to these threats. I certainly hope you do not approve of these tactics, or perhaps you aren't aware of them, Governor Cuomo, which seems to be a consistent pattern. Nonetheless, Select Subcommittee is holding this hearing today to examine your administration's handling of the COVID-19 pandemic in New York. Specifically, we want to focus on the issuance of a directive that resulted in the admittance and readmittance, according to the AP, of more than 9,000 potentially COVID-positive individuals to nursing homes. The Select Subcommittee has been authorized to investigate the COVID-19 pandemic and to explore lessons learned, positive or negative, to better prepare for future pandemics. Since the beginning of this Congress, we've been committed to conducting a thorough investigation, free from influence and unafraid to follow the facts wherever they may lead. We've acted in a transparent fashion, cognizant that Americans deserve to see our work and review all available information so they can draw their own conclusions. We're examining actions taken by Congress, including measures I voted for, but might want to do differently or better the next time, so that when the next shocking pandemic occurs, we have looked back, found what worked and what didn't, and established a workable system so that we may endure. This is an after-action review in hopes of being able to predict, prepare, protect, and perhaps even prevent the next pandemic. In search for best pandemic practices, today's hearing is focused on New York and the March 25, 2020 directive from the New York State Department of Health issued under Governor Andrew Cuomo's leadership. In this investigation, we have reviewed more than 500,000 documents, and we've conducted 10 transcribed interviews with members of your administration, including you. Our findings are based on the evidence and testimonies that we have received. This is a comprehensive and painstaking endeavor to find out what happened in New York nursing homes, with more than 2,000 pages of testimony publicly released to support our conclusions. Simply put, America cannot move forward without first looking back. And that includes examining your directive, Governor. Mr. Cuomo, I think you'll agree that New York State became ground zero for much of the pandemic in the United States. In the earliest stage of the pandemic, COVID-19 was a novel virus, and there was little information and a lot of unknowns. But it quickly became clear that COVID-19 was particularly dangerous for the elderly. We all saw the deadly consequences of COVID-19 in nursing homes in Washington State, the earlier epicenter of the pandemic. There was a 1,000-fold higher risk of poor outcomes, specifically hospitalization and death for older people relative to younger populations. Therefore, it was critically important that the public health response prioritize protecting high-risk populations. This is an important lesson learned. This was understood by the U.S. Centers for Medicaid and Medicare Services and the U.S. Centers for Disease